The faster a vaccine for the novel coronavirus is developed and shared, the better for the global economy. Currently, economies are continuously shrinking due to national lockdowns that are in place across the world. Health economists say that the recovery of individual economies will depend on the development and availability of a vaccine. Governments must invest in the research and development of the vaccine to provide a sense of security to reopen economies fully. Let's get more on this topic. I'm joined on the line by Dr. Peter Baur from the University of Johannesburg's Department of Economics. Thanks so much for your time on SABC News this afternoon. Experts are, for the majority, saying that a vaccine for COVID-19 may not be available for at least a year. Why does the creation of a vaccine take time, and what's involved in that?
As far as I understand, the biggest problem is the trials. So once a vaccine is developed, you go into the trial phase, and from the trial phase, we go into the production phase. And so there are often, often an issue of actually going from production then to reaching the people on the one side, and then also in terms of the development and making sure that the trials are effective and all the tests, etc., have been done properly.
So in the absence of vaccine, how important is the issue of testing? If we look at what's happening in Wuhan, China, for example, they've decided to test everybody that's there to better understand and deal with the virus. Is testing an expensive exercise for countries like ours on that scale?
Yes, well, in the case of most of the developing countries, absolutely. Every single test costs money, and if you multiply that by, let's say, 50 million people, you get an idea of what the test is going to cost. Ideally, we would like to test everybody. That would be the optimum sample, but we normally do as best as we can to reach as many people as possible. Another big issue is the availability or access to those who can actually or are qualified or trained to do the test, and getting them deployed to the areas that are appropriate, and then also getting access to the individuals themselves to be tested.
Mm-hmm. Is the South African government getting it right when it comes to utilising the evidence that they have at their disposal in terms of how to proceed with a lockdown? And being a health economist, is it a case of health is important first, or the economy comes first, or what's the happy medium between the two?
Okay, just a small correction there. In terms of my field of interest, it's more on the cultural side of things. And so what we look at right now is that the impact of a virus with lockdown, your big challenge is the spread of the virus is going to be very much dependent on a number of issues such as poverty, inequality, population density, etc. So without lockdown, what is actually going to happen is all the other variables remain pretty much constant. So by locking down the population, you are actually delaying the real impacts of this virus. So let's suppose there's a certain group of people who are most likely going to be impacted by this virus, given all the other variables that I've just mentioned. And so what happens is while the lockdown's happening, it's preventing people from being infected until we come closer to the virus. But once you've lifted that, your increase in infections will naturally increase to, shall we say, a natural rate, given all the country's dynamics. And so the lockdown is actually just slowing down that infection rate, but at the moment we lift it, it will peak or spike. That's actually a better word to use. Mm-hmm. So what we're going to now see is there is going to be an increase of infections anyway. Our challenge now is to balance out, do we build up the economy? Because as the rest of the global economy starts to unlock the economy, as they start to move themselves out of the lockdown phase, they will start to grow. And we want to grow with the other economies. We don't want to keep holding us back. And there are so many people suffering from poverty and losing their jobs. We've got to build on our economy too.
So if I'm understanding you correctly, you're advocating for an easing of the lockdown, but obviously also remembering that people's lives are important. Let's go to the United States, where it's been warned that as they open up the economy again, they need to be cautious to avoid a second wave of infections. Is it even possible to prevent that from happening? Because we know, and the health minister, among other people, have said to us that they've just been trying to delay and prepare themselves in order to make sure they've got enough beds, enough isolation facilities and the like. And they're trying to, the peak was either going to be in July or September. So what happens when it comes to that next wave of infections, and what is South Africa going to see?
Okay, this is, I think, very much what South Africa was taking care of is a situation that we're making space available for the increase in infections. So the second wave means that with the lockdown, we've slowed down the initial progress of this impact of this virus. But we know that the impact is going to grow. It is going to grow quite considerably. And so we've given our medical system time to establish beds and hospital facilities in order to deal with this. So on that side, we're correct. And yes, we are going to be facing an increase in the number of people, but we have to slow down on this lockdown. We have to start releasing the economy so that we can start creating jobs again and allow businesses to grow.
Dr. Peter Baur, thanks so much for your time on SABC News. He's from the University of Johannesburg's Department of Economics, joining us there, speaking about the lockdown and easing of restrictions and health versus the economy, which is a conversation that's been happening for a while in South Africa now.